really glad to see, and this is going to apply to primary care, many different types of providers, the expansion of diabetes screening. Previously, diabetes screening was done with just a blood glucose test, which all that tells you is what the patient's blood sugar is right now. A much more valuable test would be the hemoglobin A1C. It gives you a value that shows how out of control or in control that patient's blood sugar has been for the previous 3 months. Yes, it's beneficial to know that, for example, today the blood sugar is 120. However, if the A1C showed the patient's hemoglobin A1C was elevated, it was 9 when the normal should be closer to 5. Well, even though their blood sugar today is great, it hasn't been so great, and that's an indicator of diabetes. So to have this more, this test that tells us more information to now be covered as a screening is wonderful. They did expand and simplify the frequency limitations. So if a patient has pre-diabetes, they've been diagnosed as having the condition that leads to diabetes, then they can have the screening tested twice a year. If they're not pre-diabetic and they've never had a screening test, they can have it once a year. And then they've changed the regulatory definition of diabetes to meet the criteria for the diabetes screening. So again, the big thing is you can have the twice a year for pre-diabetes, once for not pre-diabetes, but the big thing is the hemoglobin A1C being covered as that test. It makes much more sense clinically.